The treatment of ischemic heart disease should be comprehensive, aimed at normalizing lifestyle, that is, dietary therapy, quitting smoking, achieving a body mass index of less than 25, and treating comorbid conditions such as arterial hypertension or diabetes mellitus. Patients with ischemic heart disease are recommended to engage in regular physical activity lasting about 30 minutes, 5 to 7 times a week, taking into account all contraindications, and after prior consultation with a doctor. The diet for treating ischemic heart disease should be aimed at achieving a body mass index of less than 25 and limiting salt intake to 3 grams per day. It is recommended to consume about 200 grams of fruit and 200 grams of vegetables per day. It is also recommended to eat sea fish twice a week. Additionally, alcohol consumption should be limited to 20 grams per day in terms of ethanol. In the treatment of ischemic heart disease, tablet forms of medications from the nitrate group, beta blockers, calcium channel blockers, and angiotensin-converting enzyme inhibitors are used. It is also necessary to normalize blood lipid levels, that is, either statins or fibrates are prescribed. Additionally, if there are comorbid conditions such as diabetes mellitus, it is essential to treat these accompanying diseases as well, that is, prescribe glucose-lowering medications or, in some cases, insulin therapy. In severe cases, when the risk of complications is high or the prognosis is unfavorable, surgical treatment is used. Surgical treatments include coronary angiography with balloon angioplasty and stent placement, or coronary artery bypass grafting. The prognosis for unstable angina, that is ischemic heart disease, is quite favorable with adequate medication therapy. In 80% of cases, angina attacks, that is, episodes of chest pain and ischemia, can be eliminated provided you undergo regular checkups with your doctor and consistently take your prescribed medications. The selection of medications for the treatment of ischemic heart disease is carried out only by a physician, taking into account the severity of the disease, accompanying conditions, and contraindications. Many medications have limited possibilities for use, meaning that contraindications must be taken into account. And often, patients who self-medicate may not take this into account and can worsen the course of ischemic heart disease, which may lead to fatal complications. A very important feature of ischemic heart disease is that the differential diagnosis from other conditions with similar pain symptoms involves taking nitroglycerin sublingually. This very quickly relieves pain behind the sternum literally within 1 minute and helps establish the diagnosis of ischemic heart disease. Therefore, first of all patients who have ever experienced such pain behind the sternum should immediately consult a doctor. But as emergency aid, nitrate medications can be used. Under no circumstances should you self-treat ischemic heart disease. But in the case of such pain, you can take either nitrate medications or Corvalol or Corvalment and consult a doctor with these complaints.